Axios Local is bringing smart brevity to a city near you. Local will deliver scoops, offer sharp insights, and curate the best local reporting. Our events, called Smart Take, will help readers better understand the most consequential news unfolding in their own backyards. With Local, we focus on what matters in your community.
Welcome to our Smart Take event, part of the launch of Axios Local, daily early morning newsletters to help readers get smarter, faster about their hometowns. Today we're in Denver, Colorado, and I'm John Frank, a reporter at Axios Denver. I want to thank Facebook for making these conversations possible, and welcome to our viewers on Facebook, YouTube, Twitter, LinkedIn, and of course, Axios.com. Please follow along with the Axios event hashtag and at Axios on Twitter. Over the next 30 minutes, we're going to look at the impact of COVID-19 and how it has changed the approach to healthcare here in Colorado and in Denver. Our first guest is Colorado Senator Michael Bennet. Welcome, Senator Bennet.
Thanks, John. It's great to see you.
You too. Senator, a year into this pandemic, how would you evaluate Colorado's healthcare system? What is working and what isn't working?
I think that what we've learned is that our public health system is under severe stress and probably was underfunded by about 40% before this pandemic even started. That's the critical infrastructure that will ultimately allow us to do the vaccinations and the testing that's required, the contact tracing and all of that. I think in view of how poorly funded it was, I think that people have actually done a pretty good job, a very good job at trying to get a hold of the pandemic from the county level all the way up to our largest hospitals.
Now, you're proposing the creation of a health force, to combat the coronavirus. A smaller version is included in President Biden's American Rescue Plan. How would a health force work, and why is this necessary?
It's necessary for exactly the reason that I just said. The reason I wrote the health force legislation was that I could see the lack of infrastructure in Colorado, and I worked with our public health community to draft that bill. It will put in my version, it puts almost 1 million people to work. Joe Biden's version of the same effort puts 100,000 people to work in high-paying jobs. Many of whom are unemployed veterans that can be put to work, basically helping support the public health infrastructure in our state and states all across the country. So they will be the health force will be the front lines, and it will be deployed by public health officers across the state and across the country. It's not meant to be a federal intervention from the top down, but to support people at the local level that are doing everything they can to combat this virus. We should have done this months and months and months ago. The Trump administration, of course, refused to believe there was a national strategy that was required here, and clearly there is one. So the health force, I think they're calling it the health care force, that's included in the Biden package is about 1/10 of what I originally proposed, but it's going to be very, very helpful.
Is the Biden plan enough? It's so scaled back, as you just mentioned. Also, will this come in time? We're poised to get most people vaccinated by this summer. Do we still need this?
So you're asking, is it too much or do we still need it? I mean, I think
is it enough, I guess? And do we still need it?
Yeah, I mean, that's a fair question. I think clearly we need it. And we're going to need it coming out of this pandemic. One of the things that we have realized is that, I'm sad to say this, but the United States was not well prepared to deal with this pandemic, and we won't be well prepared to deal with the next one unless we begin to invest in our public health infrastructure again in this country to support the people that are really, on the front lines here, many of them in rural parts of Colorado, facing all kinds of demands even before we had a pandemic. So yeah, we're going to need it, and it's the right amount.
This week, you reintroduced Medicare X, your idea for a public healthcare option. You first introduced this legislation in 2017, and it didn't make much progress. So what's changed, and how would it be tailored to address the pandemic?
I think what's changed is partly the pandemic, and I think a realization that doesn't do anybody any good to have a country where we've got a medical system where people don't have access to primary care so that they can get regular screenings. And I think what else has changed is that we should have had a public option in the original Obamacare bill, and we just never did it. I mean, we couldn't do it at the time. I don't think there was as much support then as there is today for universal health care. Today, I think there's enormous support for universal health care. As you mentioned, it's been a number of years since I've been trying to get a public option introduced. I was the first person during the Affordable Care Act to actually call for a public option, and in a letter to President Obama. So it's something I've believed for more than a decade. And my co-sponsor, Tim Kaine, has been a huge addition to the bill. We are now going to make it available to small businesses. And another change in the bill is that it will allow people to access primary care without having to pay a copay, which I think is going to take one more barrier out of the way. It doesn't do anybody any good to have people uncovered, to have no health insurance in this country, and to get their basic health care at the emergency room. It's a stupid way to do it. It's an expensive way to do it.
Now, Governor Polis and state lawmakers here in Colorado are exploring their own state-level public option. Should this be done at the federal level or the state level?
Well, I see these as I don't see these as conflicting efforts, but I hope that we're able to do it at the federal level so that the millions of Americans that don't have access to health insurance are able to have access to it. But I'm well aware of the work they've been doing and been following in the legislature for the last several years.
Now, we only have a couple minutes remaining. Let's try a couple rapid fire questions on topics of the day. The Biden administration's pick for budget chief is facing hurdles. Will you support Tandon's nomination, and why?
If it comes to the floor, I will. Yeah.
Mm-hmm. Mm-hmm. And you voted in favor of the Keystone Pipeline years ago. Do you still support that project? That's coming back up as another topic.
My position always was that I didn't think Congress should be in the business of approving or disapproving a pipeline. I still believe that. I just think it's not a good use of anybody's time here. And it's just, all these years, it's just been a political distraction from what we need to be focused on, which is combating climate change and figuring out how to help communities that are transitioning away from their dependence on fossil fuels or on the on mining and other kind of extractive industries. I think that's what we need to be paying attention to.
Now, of course, you face re-election in 2022. How worried are you about a potential challenge from former Senator Cory Gardner?
I don't know what Senator Gardner whether he's going to run or not. He'd obviously be a formidable challenge. We both have our, the voters of Colorado know our voting records extremely well, and I think I feel very comfortable facing re-election with the voting record that I have.
One more politics question, and we'll get back to healthcare, but more liberal Democrats are also considering a potential primary challenge against you, here on the other side. Is that a threat, you think?
Look, a political threat can come from anywhere. I've just tried to, over the last decade, have a deep keel, understand that I represent the entire state, which is a third Democratic, a third Republican, and a little more than a third unaffiliated. And I think that I've done that honestly and well. So I don't know where the challenge is going to come, but I'm prepared for it no matter where it does. I'll say just on this point, though, that one of the things I'm incredibly happy about is that President Biden has included My American Family Act in this next COVID bill. And that is a massive increase to the child tax credit that will cut childhood poverty in this country by almost 50%. And I'm deeply grateful for that. I think that the people of Colorado are going to benefit a lot from that. At least 50,000.
Well, you already hit on my final question about what you wanted to see in that stimulus package when it came to COVID relief. So I guess we'll leave the conversation there because that's all the time we have. Okay. Thank you, Senator Bennet, for joining the conversation with Axios. It was good to talk to you.
Good to talk to you, John. See you soon. Thanks.
Sounds great. Up next, we have our View from the Top segment.
Thanks, John. Now I'd like to introduce our next guest, Dr. Hollis Saubery, who is the founder of Physician Moms Group. Welcome, Dr. Saubery.
Thank you so much for having me, Londa. Thank you so much for having me here.
Absolutely. We're happy to have you here. So I would love to talk to you a little bit about the story behind Physician Moms Group and how the page has grown into what it is today.
So Physician Moms Group is a community of 115,000 physicians, but it didn't start that way. It started out with me and 20 girlfriends talking about how to be doctors. We learn how to be doctors clinically in medical school, but no one actually teaches us how to live as physicians once we start growing our families and having kids and complicating the factors of taking care of anyone else besides ourselves. So I started having children. I personally have 5 children between the ages of 2 and 7. I have 2 sets of twins in there. And so there became a point where I felt that I didn't have the support that I needed, either from, work support or colleagues, or even in my personal family, to understand how to continue to be the best doctor and how to continue to be the best mom. So I started a community of just 20 of us on Facebook one night, and the idea just spread like wildfire. And so many people wanted to be part of this group because they knew that they needed that connection. So over the last 6 years, we grew it from 20 girls to 115,000 people, basically starting a revolution in medicine of what it means to be a woman in medicine, and also addressing really hard topics like burnout and the systemic oppression of healthcare as an institution on the doctors, and how that really destroys the relationship between doctors and patients. And so it's definitely grown over the last 6 years, not only in number, but also in our mission.
Great. And you've already spoken to a few of these issues already, but what are some of the most amazing or unexpected things that kind of comes from doctors coming together, exchanging tips and care practices on the page, but also just like women kind of coming together on the page?
Yeah. So I think it's really unique because our page represents with basically what doctors can do together without any outside force, like just with our pure love for medicine, our talent, our expertise, since we have physicians that specialize in all parts of medicine. So before COVID happened, we were already seeing this type of crowdsourcing that we were doing that organically started happening on our group. Things like, someone posting that their patient needed a certain resource that wasn't in their area. And within minutes, finding multiple options of getting their patient connected to that resource. And sometimes that patient was their family member. So, as you can imagine, it's a really powerful tool to, get on there. And I've personally used it, for a family member needing, a second look with a cardiologist, and, posting, with his permission, what was going on with him. I was able to get 20 cardiologists to respond within literally less than a half hour, all in agreement with, what the next steps were. And so for me, that gave me a lot of clarity and calmness, because it's hard to be a doctor and a family member at the same time. But I've seen many physicians advocate for their patients in the same way. And so it was a really unique situation when we started with COVID to see that we already were crowdsourcing and how we were going to be doing it and tackling this pandemic without much structure, because we didn't have the journals to turn to. We didn't have the authority figures to turn to at that time. We were turning to each other.
And it sounds like there is a mixture of people from the Denver area and then people who are outside of the Denver area. Do you ever see a difference in the kind of conversations that are had between the two groups?
Well, we're all humans and we all are, suffering from the same diseases. So they're not very different, but I think the needs are a little bit different for the area. Speaking to Colorado specifically, we have a team of 25 moderators that moderate this board and, keep it in line and structured and clinically based. One of the moderators is Dr. Terry Krause, who's a family physician in the Denver area. And so she was able to take information from our new COVID group, which is part of our Physician Moms Group community, and share it not only with her health system, but also to use that information to aid the bigger university health systems to figure out, what their protocols would be. And then when, vaccine distribution became, a topic, how are we going to, distribute that information, not only to the physicians, but also to the patients as well. So it was a really useful tool to have our moderators, which are really diverse in the areas that we practice. We even have moderators, outside of the country and outside of the United States, and to be able to use that crowdsourcing tool to be able to disseminate information further. So it's been really useful, not only in the Denver area, but to, every major city, around the states.
I always believe there's something very powerful about women coming together. What have you seen about how the page has been able to build community and build the support system, especially right now where so many of us are remote, so many of us are disconnected, and to kind of have that women's support group, that mom support group online?
Yeah. And what's so sad to even say is that this isolation that many people are feeling, women physicians have been feeling for much longer, actually probably for most of their career since women became physicians for the last 100 of years. The other thing I want to mention is that women coming together during a pandemic is not unique to COVID. We saw this in the 1918 flu, where there were tons of women empowerment movements and the labor movements at that moment because of how women came together to support their communities when most of the men were actually dying from the pandemic, from the Spanish flu during the war. And so although the situations have changed, the circumstances are mildly different, now we're still seeing women coming together and stepping up as leaders, not only, in our industries, but also with our families and our communities. And so it's been a really, really useful tool, and expanding our community beyond Physician Moms Group to add Physician Moms Group COVID group. What that did was it kept Physician Moms Group as a safe space for women to discuss sexism, gender bias, racial injustice, and not allow that to be pushed to a side because there's a hot topic that is more important. And that's why these topics of, sexism and discrimination get pushed to the side, because there's always something more, pressing to talk about. And so I think that we're able to maintain having those discussions and still advocating for women in the workplace, which I can give some examples for, but also giving space for COVID and the pandemic and inviting men to that conversation and almost modeling what it would be like to have a community of crowdsourcing. Because since Physician Moms Group was made, other communities like Physician Moms Group have popped up. It served as an inspiration for other physicians to gather with a different focus, whether it's a specialty focus, an area focus, or even there's a physician dads group. And so it was really neat to have the admin of the founder of the physician dads group reach out to me and say, hey, is there a way that we can collaborate? And he's an amazing physician, Dr. Johnny Diaz. And so we were able to introduce the communities to each other and use that power of knowledge together. And it was funny because a lot of the physician dads group members had reached out to me at that time going, wow, like you guys are so organized. You guys are so, fill in the blank. And it was really neat. It was a great merit to see that, here we were working side by side and to see that their admiration for what we've done, as a community together. And so it's only inspired more community leaders to step up within the physician realm and to do more and take COVID not as an obstacle, but more as an opportunity as to what healthcare can look like in the future.
Well, I thank you so much for joining us today, Dr. Saubery. This has been fascinating. Really appreciate your time today.
Thank you so much.
Thank you. Now over to my colleague, Elena Alvarez. Elena?
I'm Axios Denver reporter Elena Alvarez. Our final guest today is the Chief Medical Officer of Denver Health, Dr. Connie Savor Price. Dr. Price, welcome.
Thank you.
I know you are regularly meeting with hospital officials across the state, so I'm curious if you could just take us into, give us a local look at what's going on in hospitals around the state. What's going on?
Well, our census is way down, almost to the lowest point we've seen since this pandemic has started. So that's really good news for our hospital capacity, and it allows us to start taking care of patients who have delayed care for a while. So good news on that front. Also, the testing positivity rate is also way down. So everything is pointing in the right direction.
Great to hear. I'm curious, we're coming up on the 1-year anniversary of the first COVID case in Colorado. What have you learned so far as working under our current health system, and what isn't?
Well, we know that we're very creative people in healthcare, and we had to roll with this very quickly without a lot of prep. So one of the advances during this pandemic was telemedicine. Early on, we had to defer a lot of elective work, decrease our clinic capacity, mostly because of personal protective equipment shortages and social distancing needs. And so we had to get creative. How do we get patients in? And many of us now are well-versed and much more advanced in our capability to deliver medicine through either telephone or video conferencing. So that's something that's worked well, and I think it'll stay with us after this pandemic. What we've learned that didn't work well is we've had a lot of issues with the supply chain, mostly equipment coming in, testing equipment, testing capacity, and also just hospital capacity. At baseline, hospitals run at near 100% capacity. So we didn't have a lot of ability to surge like we would have liked to in this pandemic.
Talk to me a little bit more about how COVID care in general has changed. I mean, are our hospitals better at preventing deaths now than they were before when this first started?
Yes, we learned a lot during this event. So early on, when we first were seeing these patients, they would come in with very low oxygen levels. A normal protocol when you get to that kind of oxygen level would be to put the patient on a breathing machine, put a breathing tube in, put them on a breathing machine, and until their oxygen levels got better. We learned very quickly that COVID patients have the ability to tolerate lower oxygen levels, and we don't need to be as quick with the breathing tube as we were in the beginning of the pandemic. And that seemed to correlate with lower rates of mortality, at least in our Colorado hospitals, with avoiding too early of ventilation. So that was something we learned. And then we had new drugs come out that had some benefit in preventing deaths and decreasing length of stay in the hospital.
With all of that experience that's that has been gained over this past year, do you think that our hospital system is poised now to handle perhaps the next pandemic even more effectively and faster? Do you feel confident about that?
Well, we certainly would be able to respond in an improved and better way. The challenge is just where we get the people for the next surge. And I always worry about that. Even after this pandemic is over, I worry we're going to lose people in healthcare because of burnout. And then as we get back to normal, to be able to maintain our vigilance in our exercising our protocols, exercising our surge capacity, and just generating the people we need to take care of patients. That is something that's hard to be constantly prepared for.
Right. I remember when we talked, Dr. Price, in November, you had mentioned a staffing shortage or a concern about that at Denver Health. Can you talk to me a little bit about what staffing numbers look like in Denver Health and perhaps even other hospitals across the state?
Well, so when we spoke in November, we had been at this since March. And so early on, everybody was working full time and then some because we were accommodating this large surge into our hospital. Nobody had taken vacation. Everybody was working extra. By the time November rolled around and we started seeing more patients come in again, some of our people needed to take a break. Some of them just didn't want to do the extra shifts anymore. And then we had more patients than we did during the first surge. And we were also trying to do our normal hospital operations on top of it. So we had fewer people to pull from because our clinics were actually open. They had to be at that point. We couldn't keep them shut down. So fewer people to pull from. People who were exhausted through the first wave were less available to us. And then as the country as a whole was surging at the same time, all of the contract agency staffing availability was diminished to us because everybody was trying to pull from these agencies. So it created a really large challenge.
I want to switch gears a little bit and jump to a question that I know is on all of our minds, which is, when can we lose the masks? Do you think, do you foresee them sticking around for a while? Do you see a light at the end of the tunnel?
Yeah, I see a light at the end of the tunnel. I think what we're going to wait for public health guidance on is when the rates across the state, across the country, really get to a low enough level and we have enough of the population vaccinated and some sustained decrease in transmission. I do anticipate that our public health authorities will pull back on the mask mandate. I suspect, though, that many people will opt to use masks more routinely after this pandemic, even if they have the choice to not wear them. So I think we'll still see them, but I don't think we're going to be mandated to wear these throughout the rest of the year. I don't think.
All right. Time will tell. We'll see. I hope you're right, personally. Dr. Price, looking beyond COVID, do you worry about a delayed uptick in other illnesses or conditions that may have been neglected because of COVID?
Yeah, well, an uptick in other conditions. I think one thing we're really worried about is the behavioral health crisis. So all of this isolation has really increased some of the calls we're getting for mental health issues and our hospitalizations for mental health issues. So I think the next pandemic we're going to be dealing with is a mental health pandemic, and we need to be really prepared to respond to that. That's one of the good things about telemedicine, is that is also a service that makes access to mental health services more readily available.
Thank you. You've been so generous with your time, Dr. Price. I just have one more question. It actually comes from a reader here in Denver who asks, Americans pay the most per person for healthcare in the world and yet have mid-tier healthcare. Where is that money going, and how do you think we fix the problem?
Oh, I love this question. We deliver healthcare in a different way than many other countries. We have, insurance companies that are involved. We have a lot of overhead in having to administer healthcare to our population. There is a lot of debate about how to make this more cost effective. And I think there's a lot that we can cut out to make healthcare more affordable. Some of that conversation is very difficult to hear, though. It might involve more centralized government-run healthcare for some. That would be one of the proposals. Making sure that everybody can opt into something like an Affordable Care Act. These are the things that have been explored, but we have been challenged in getting them off the ground. So not an easy solution, but I agree with the listener that we need to keep tackling it.
Well, thank you so much. It's been a pleasure, as always, talking to you, Dr. Price. And we just thank you for joining Axios.
Great. Thank you so much for having me. I appreciate it.
Thank you. And thank you all for joining this afternoon for another virtual conversation that has made everyone smarter, faster. Thank you to our sponsor, Facebook, as well, for making this event possible. For more info on how to sign up for our newsletter, Axios Denver, visit axios.com/local or the Axios app. And one final announcement before you go, Axios just kicked off our Get Smart vaccine series. We're launching 5 short videos that aim to make you smarter, faster on the latest vaccination rollouts. You can join us by visiting axios.com/get-smart/vaccines. Thank you again for joining us today.
herd immunity,
DNA, RNA, mRNA,
distribution.
it's really important to understand how vaccines work.